Are hidden food sensitivities sabotaging your ability to heal your gut? For a long time in healthcare, it was thought that unless you had a true allergy through a standard allergy test to a food, that you could continue to eat those foods without any problem. Well, sadly, many people have taken that advice and have continued to get sicker and sicker because of other types of reactions to foods. And the current research has really caught up in the last few years and shown that traditional allergy testing, while it's very helpful for an IgE reaction, which is your typical immediate type of allergy reaction, does not account for different types of antibodies that also play a massive role in the inflammatory processes in our body. And these are antibodies such as IgG, IgA, and IgM antibodies. And these are known as a bit more of a delayed response, a little bit more of a subtle response, but they can be just as powerful to create problems for us. And it's very tricky for the average person to figure these out on their own because the delay can be upwards of a number of days to well over a week before some of these symptoms start to arrive. And these symptoms can be anything from gut issues all the way down to skin issues, joint pain, migraines, anxiety and depression, and even weight gain can be impacted by food sensitivities. Fortunately, more and more research is going into food testing all the time, and we've come a long way. An example of this is in the past, many people were told that unless you were diagnosed with celiac disease, it's okay and safe to eat gluten. Well, we now know that that's completely untrue. In fact, celiac disease is a result of a severe allergy to gluten. It's in approximately less than 1% of the populace. But there are those that have what is called a non-celiac gluten sensitivity, and this I'm seeing in my populations that come into my clinic, approximately 30 to 40% of my patients have a non-celiac gluten sensitivity, which can actually be just as bad as having a celiac in some cases because it creates a lot of different systemic inflammatory processes. Now, the testing out there right now, it's gotten a lot better, but it's still not perfect. And if you are looking for food sensitivity testing, I highly recommend working with a lab that combines all the different antibodies together. So the collection of the IgG, IgA, IgM, and IgE antibodies under one roof. It's often in a blood test. And that's going to give you a much more accurate sense of the full degree of your reactivity to foods. But until that testing comes around, literally the best way to identify if you have a problem to a food is the traditional elimination reintroduction technique. And there's nothing sexy about this, but it works. And what you do is you pick the foods that you're suspicious of and you remove them. And you remove them for a minimum of 2 to 3 months. That may sound like a long period of time, but remember, these reactions can take many, many weeks to many, many months to actually create a full impact and create illness and aggravate illness. So you remove these for 2 to 3 months and then you reintroduce them one at a time, one per week, and you observe how you feel. And until the testing is right where it needs to be, that is a very helpful tool to help you identify if hidden food sensitivities are sabotaging your ability to heal. So for more tips and free guides, please jump over to thehealthygutinstitute.com, and I'll see you at the next video.